We had earlier looked at demographic health surveys, but the basis of why surveys are conducted is because there is need for data, and the need for data is as a result of trying to understand your population in terms of its demography, in terms of its socioeconomic health, and other characteristics that the population has. And we also very well know that the need for data is in order to make decisions, but also policies in terms of trying to uh, govern populations. And mostly for those in the in the health sector, the need for data is most importantly for prevention of diseases, for uh, curative measures, but also some therapeutic measures. So that is why population data is very key. And today we want to look at population data in brief, so that we understand the gist when we're talking about population data. And we're going to look at the sources of population data and the sources of errors in population data for today. Then tomorrow we shall be able to state the ways of improving population data quality and some of the methods of presenting population data. So, briefly, population data refers to demographic information about a specific group, providing insights into its characteristics and dynamics. And some of these characteristics are what we have always known, that include the demographic characteristics such as age, education level, household size, the gender or the sex of household or household members, uh, places of residence, but also other characteristics that might be biomarkers such as someone's HIV status, an individual's blood pressure levels. We would be looking at malnutrition among under fives in terms of stuntedness, uh, wasting, and so forth. So those are some of the characteristics. But also looking at dynamics, we want to understand how the populations interact. For example, we want to understand how places of residence might influence a certain behavior, probably a health behavior or probably an economic seeking behavior. For example, you may not, in a predominantly Christian area, you may not take products that are not that are not preferred in Christian areas, in those Muslim areas. So you have to understand the characteristics of a particular population, even in terms of business. You cannot take Qurans where the place is predominantly Christian. So likewise, food products, medicine, and so forth. You may not take a modern family planning method to a Catholic Church basis, because the teachings vary, but also the practices vary with what you would be taking. So those are some of the importances of understanding population data and the dynamics in which individuals live. So it is also crucial for informed decision making, policy formulation, and resource allocation in various fields. You are able to understand which population needs which kind of intervention. So in a population where in an area or population where the population has women who are above the age of 49 with the highest number, it will be very absurd that you take their family planning services, because these are people who are away from the reproductive age. So it helps you make decisions that are from an informed point of view, and you can only take such kind of services where need be. And therefore, you as well can do what they call resource allocation, and you're able to realize probably which region has more elderly people, then you can have a social protection fund so that you can help such elderly persons to survive in the communities that they live in. So there is what they call population data measurement. We want to measure the data, or we want to understand what the population is in terms of its dynamics and in terms of its characteristics. So how do we measure the population? How do we measure the characteristics and so forth? So population data can be measured through numerical or categorical measurements or observations. And when we're talking about numerical population data, we're looking at the number. Well, numerical comes from the word numbers. Therefore, we are dealing with figures here. And therefore, we can be looking at numerical data such as the number of people living in a certain country, the region, or a city. So, say in looking at numbers, we're looking at the number of women, the number of children, the number of under fives, the number of infants. We're looking at the number of PWDs. We're looking at the number of persons living with HIV. We're looking at persons who are elderly. We're looking at teenagers. So that is how numerical data can be aggregated. So you might also have another numerical aspect is the looking at the average age, income or education level of a population. You want to look at the frequency or distribution of certain health conditions. For example, you want to understand how diabetes is distributed across a certain population. For example, you will take working class or individuals who are working in the government public service, and you want to understand the health living conditions among such people. Most times you realize that diabetes and these other what we call non-communicable diseases, or what they call diseases of the rich, might be predominantly among those who are doing some work or who earn probably a monthly salary. Or you might even realize that there are people who are educated or living in urban settings. So those are some of the numerical measures through which we can measure the characteristics of the population. You can use the central tendencies using mode, the median or the mean of a numerical variable measured for a population, and you can be able to understand the population numerically. But also there is what we call the categorical population data, and this is the percentage of people who identify with a certain gender, ethnicity, or religion. So, when you're looking at categorical political population data, you're only looking at a specific category or group of people. For example, you're looking at females only. You're looking at male. You're looking at people of this particular tribe. You're looking at people of this particular religion. If you're looking at Muslims, you're looking specifically at Muslims. If you're looking at Christians, you're looking particularly at Christians. Presbyterians, you're looking at them, but also the various religions under which you would want to do that particular categorization. So that is what we call categorical population data. As an aspect measurement of population. So we want to also understand how population can be analyzed. Population data can be analyzed. So having categorized data and how it can be measured, it is critical that you understand how analyzing population data is also done, or how important it is. So population data can be
your slides are not moving.
Okay, let me just adjust here. It's not moving for everyone because I can see in my aspect in my presentation here that they're moving. They're not moving. The slides are not moving. I'm on analyzing population data.
Yes, I can see the slide well.
So
The
can
slide
I
is
continue
clear.
if you're seeing the slide? It's not clear.
Continue. It's now clear. Before it was not moving, but now you are in that right place because by the time you click now, it appears in that location. But when you started from the first page, it wasn't moving.
I think it's the network is a little slow, so it takes time to move to the next. So we're looking at how population data can be analyzed using descriptive statistics, and we're saying data can be analyzed using descriptive statistics and what we call inferential statistics. And when we're talking about descriptive statistics, we are looking at summarizing the key characteristics of a population data set. And the measures or the analyzing codes for descriptive statistics include a measure of the central tendency. And when we're talking about central tendencies, we are looking at the measures such as mean, median, and mode. So these are measures that tell you where the data points are. For example, if you wanted to look at the mean age at first sex of females, you should be able to collect the age the age group of all females of reproductive age, and then you're able to line list it according to age, and then you're able to line list which of these females of reproductive age have actively engaged in sexual intercourse and at what age, and then that can help you using the mean to identify the mean or the median age at which women in a particular country have their first sexual intercourse. And those are some of the indicators that you can help to understand the sexual behavior of people in your society. But also another measure in descriptive statistics is dispersion. Measures like variance and standard deviation quantify how spread out the data is, and we understand how variance works. So therefore, you are identifying the variation of your data, and then using standard deviation, you're able to make analysis of your key indicator. So these are how you can describe data and analyze data. You can also use frequency distributions such as histograms and box plots to show how often different values appear in the data. For example, if you wanted to do a descriptive statistics of women who are attending antenatal care in your health facility, you can have a histogram, probably by month, just showing how many women came in the first month, how many came in the third month, how many came in the fourth month, how many came in the fifth month, just like that. But if you want to as well understand the trends such as using the malaria channel, you're able to draw trends for the previous year, and then you measure it against trends of the current year, and all these are descriptive statistics. So from descriptive statistics, you can use what we call inferential statistics. And this allows you to draw conclusions about the larger population based on the information obtained from a sample. And I think when we are doing reproductive health issues, I think we tackled some of these basic statistics terms. So probably they are not new terms to you as of now. However, the two key inferential statistics include hypothesis testing, where we formulate a null hypothesis using the statistical tests and see if the data provides enough evidence to reject it. So for those who have done their research, you're supposed to state a null hypothesis and then prove your hypothesis through hypothesis testing. So, for example, in your research question, if your null hypothesis is that all women who attend antenatal care have live babies or live births, then through your research you can be able to prove whether antenatal care or attendance of antenatal care is actually an automatic lead into having a live birth, and then you can be able to reject or sustain your hypothesis. And then we look at confidence intervals, where there is estimating the range of plausible values for a population parameter based on the sample. So the confidence intervals are giving us the odds or the values in which particular characteristics lead to certain outcomes. For example, it is important that you state in analyzing your population data, if you wanted to subject a particular health condition, let us use high blood pressure to certain characteristics, then using confidence intervals, you're able to understand whether at a confidence interval of 95%, living in an urban area actually contributes to high blood pressure among the community, or having no education or primary level education actually has an impact on someone's high blood pressure levels. So those are some of the means in which you are able to use the confidence interval to do data analysis. And we shall look at some of the case studies on how data analysis can be done. But also in this particular module, we shall expect that each one of us downloads the data from the demographic health program, and they are able to do analysis of that data and share with us, so that we understand the level at which the practical aspect of what you're studying has reached. So having understood analysis, we also need to understand collection of population data. And population data can be collected using the various methods, I think, which we have definitely looked at. So this is just a brief of collection of population data. And we're saying these are surveys, censuses, experiments, but also administrative records. And we know how surveys are often conducted using the questionnaires and so forth, and all those other methods of data collection. So population data can be affected by various sources of error, such as sampling bias, measurement error, non-response, or missing data. So then we therefore want to understand from that statement that it is mostly affected by various sources of error. we now want to understand some of the types and sources of error, especially in population data. And we're looking at four main errors or sources of error in population data. And we're saying one, we have classification errors, two, we have coverage errors, we have content errors, but also we have processing errors. And when we're looking at uh, these four errors, we want to understand from each of them what they mean. And when you're talking about classification errors, we're saying these are errors that occur when an individual or events are placed in the wrong category or groups. Sometimes classification errors are called sampling errors. And sampling errors, the sources mainly of sampling errors originate from misinterpretation of data. Two, ambiguity in classification criteria. So ambiguity means that sometimes you have a large sampling area, and therefore your sampling area may not be as clear as possible. For example, uh, you want to sample men, but you write it as male, and therefore male or men or start from the age of zero to about the age of infinity, or about 100 and something for those who have a correct age expectation. So what happens is that it is very important that in your selection criteria you make it less ambiguous, and therefore you just state that you want to understand. For example, you want to understand the demographic characteristics that are associated to uptake of modern contraceptives among women of reproductive age. And when you're talking about women of reproductive age, we understand that it will be between the ages 15 to 49. And therefore, you are able to further ahead go and say women of reproductive age in this particular area or in this particular county. So that is a sample that is clear, straight out, and therefore there are categories where you may not. So particularly, you will go to that county and look at women of reproductive age. So how errors occur is that people individuals go and they are placed. For example, you interview a woman who is not of reproductive age, who is probably of the ages 12, or who is of the ages 50 and above. So that is where some of the classification errors come from. So an example is that there is assigning an individual to the wrong group or to the wrong gender. So you may assign a man to a female gender. Secondly is what we call coverage errors. And coverage errors are errors that result from the failure to include or exclude some units or events in the census enumeration. Coverage errors can be further divided into omissions, duplications, and erroneous inclusions or exclusions. They arise when certain groups or individuals are excluded or included incorrectly in the population data. So this may occur during your enumeration, and you may include individuals who are not supposed to be included. For example, in the national population census, there is supposed to be a category for the non-national enumeration and national enumeration. So you may realize that there are certain people who are not citizens of that particular country, but because the census defines them in that country, they might be counted as nationals of that country. But also there are aspects of people hiding information, and therefore you may include or exclude them erroneously in a particular study. So that is where the coverage errors come from. So some of the sources include incomplete data collection, but also we have sampling bias. Sampling bias is as a result of the enumerator or the individual who is conducting the particular study biasing or having their own thoughts on the information that they are supposed to collect. So in sampling, whereas you may develop a sampling model of random sampling, an individual may be biased and decides to go a particular village or to a particular place that rhymes with their own thoughts, ideas, but also their practices. So you may find it easier for a Muslim to go and do an interview or to go and perform enumeration at a Muslim predominantly area or near a mosque than them going into a Christian predominant area or to a church area. But also for traditionalists, you may as well find it very hard for them to go to certain locations because of the norms, but also their practices and their thoughts and beliefs. Therefore, this may cause coverage errors. So, thirdly, we have content errors. And when we're talking about content errors, we are meaning that these are errors that result from the incorrect recording or reporting of the characteristics of the units or events in the census. And content errors can be further divided into errors of geography, errors of classification, errors of measurement, and errors of processing. So when you're looking at content error, as a result of geographical distribution, you may, when the issue of boundaries comes in, it is often very hard for us to enumerate individuals because then there are individuals who stay in the neighborhood of a boundary whose families stay across the next area, then they might be farming across the two boundary areas. And therefore, sometimes errors occur in terms of classifying these individuals, but also in terms of measurement. Sometimes it is very hard for individuals to measure. And measurement has errors regarding age and so forth. Some individuals may not be very comfortable mentioning their ages, but also they may not be aware of their ages, and therefore having measurements of such age become a little hard, and that is where we have content errors that arise in population data, and they stem from inaccuracies or inconsistencies in information collected. And most of the sources, like I've said earlier, they are as a result of respondent errors in surveys. So respondent errors, we are looking at how someone gives you a response. The response may be inadequate or the response may be false. And therefore, these cause errors that we refer to as content error. Then there are also incomplete or outdated records. And these records may be administrative records where these were written and some part of the data was not captured. And therefore, this leads to guessing and might be incorrect. And examples include incorrect birth rates, birth dates, misspelled names, and inaccurate addresses. Someone may say that they live in this city, yet they are living in a different location. And lastly, we want to look at processing errors. And when we're discussing processing errors, we are talking about errors that occur during data entry, analysis, or transformation stages. And these mostly occur as a result of human error in data input, software, or system glitches. And some of the examples of these include miscalculations during edge computation or database corruption. So we very well know that sometimes when we're doing data entry, as a result of large or bulk data, there are some errors that may occur. And these are some of the errors that occur during processing of data. And therefore, some softwares as well might crash, leaving us with processing errors. So processing means these are data that are now being transferred from their hard copies into an electronic version of the data. And as a result, we experience these errors. So those are the four main errors that might be associated with population data. However, we want to understand, having understood the types of errors that might occur in population data, we want to as well understand the importance of addressing these errors. And the importance of correcting these errors is very crucial to ensure the reliability of data. Remember, from our research, the principle is that research must be reliable. And therefore, if you're able to correct these errors, you're able to make your research as reliable as possible. Another importance for addressing these errors is that they can lead to inaccurate policy decisions, resource allocation, and planning. So, if these errors are not corrected, the policymakers may be basing on these errors, and it may be unfortunate that they make decisions and allocate resources where there is no need. And this is a very important aspect of addressing errors. Say, for example, they may allocate delivery beds to a health facility whose catchment population has less female or women of reproductive age, whereas a health facility that is located in an area that has a high population of women of reproductive age may not be allocated delivery beds, may not be allocated maternity ward, may not be allocated those coaches that might be needed or that could be very important for that particular population. So that is how those errors may lead to such inappropriate decision making. So, what are the strategies for
I don't know whether network, the screen is not seen again.
I don't see any slide. What happened?
Yes, what is going on? I'm not getting any information.